Hello everybody, my name is Nathan Hutting from the Netherlands. I'm a physiotherapist and manual therapist and work as a researcher at the Han University of Applied Sciences in Nijmegen, the Netherlands. I'm also a board member of the Dutch Manual Therapy Association and I'm the member organization delegate of the Netherlands in 𝗖𝗥𝗘-𝗧𝗥𝗘𝗔𝗧. In September this year, the 9th European Congress of Manual Therapy will take place in Antwerp in Belgium. And this year's topic is Manual Therapy, the Future Ahead, and it's about cervical cephalic complaints. And as you can see, there are some really great speakers that will present during this conference. Before this congress, there will also be some really interesting pre-conference courses. And I will present a pre-conference course about pre-treatment clinical reasoning and examination of the cervical spine. This pre-conference course will be on Thursday, September 19 from 1 to 7 p.m. at the University of Leuven. Manipulation and mobilization of the cervical spine are well-established interventions in the management of patients with headache and/or neck pain. However, their benefits are accompanied by potential, yet rare risks in terms of serious adverse events. Therefore, prior to cervical spine manual therapy, a risk-benefit analysis should be performed in which the potential risk factors for vascular pathologies and complications after manipulation should be weighted against the potential benefits. This risk should be estimated for each patient based on all current factors surrounding the particular situation at that particular time. In their clinical reasoning, manual therapists must rely on the information based on the patient interview and physical examination with regard to clinical signs and symptoms and available risk factors for the different diseases or disorders and interpret this information carefully. There are three important steps in the clinical reasoning process. The first one is identifying a possible vasculogenic contribution or other serious pathology. The second one is determining whether there is an indication or contraindication for mobilization or manipulation. And three, assessing the presence of any potential risk factors associated with potential serious adverse events which are reported to occur after cervical spine mobilization and/or manipulation. This pre-congress course will be partly based on our 2018 publication in Musculoskeletal Science and Practice about considerations to improve the safety of cervical spine manual therapy. This course will start with a general introduction on vascular pathologies and injuries which can present as neuromusculoskeletal dysfunction. After this first introduction, this course will focus on the knowledge and skills necessary for the assessment of patients with head and neck pain and their risk of adverse events. We will focus on the mentioned three important steps in the clinical reasoning process. In this part, the benefits of treatment, indications for cervical spine manipulation, risk of cervical spine manipulation, anatomy of the upper cervical spine region, potential risk factors, and contraindications will be discussed. Moreover, practical guidelines for the patient interview and physical examination will be provided. After following this course, you will have extensive knowledge about identifying vascular pathologies in the cervical spine region which can present as neuromusculoskeletal dysfunction and about indications, contraindications and risk factors for cervical spine manual therapist. You will also be able to conduct an evidence-based clinical reasoning process and examination focused on the recognition of a vascular contribution and prevention of vascular complication before applying manual therapy treatment in the cervical spine. I look forward to meeting you during this pre-conference course, pre-treatment clinical reasoning and examination of the cervical spine on Thursday, September 19 in Leuven.